Hello everybody, welcome to my YouTube channel. Welcome to Healthy Lifestyle Matters. Yeah, I encourage you to be your own doctor. How do you become your own doctor? By living the healthiest life possible, so that we don't get sick. For those who don't know me, my name is Stephanie Agbonkwai, but I'm popularly known as Daughter of Zion. Thank you for subscribing, thank you for tuning in, and please watch this video till the very end. Okay, okay. So welcome to another episode of Health Talks. Yeah, I encourage you to be your own doctor. Okay, so without wasting much time, let's dive into what brought us here today. I know you guys are so eager to listen, and I'm here to give the vibes. So today we're gonna be talking about causes of hearing loss. Okay, I got mine. Whatever. So today we're gonna be talking about causes of hearing loss. So what is a hearing loss? It's deafness or your inability to hear when somebody speaks to you. So what are some of the causes of hearing loss? We're gonna be talking about them today. So remember, we're talking today about hearing loss. And what are the causes? So by hearing loss, we mean by definition that it is deafness, your inability to hear. So causes of hearing loss, there we go. The first point is earwax can cause hearing loss. Too much earwax in your ear canal can cause hearing loss. We know that, right? So that's what we're talking about. So too much earwax on your ear canal can cause you hearing loss, can cause your hearing to loss. So that's what we're talking about. So the number 2 point for causes of hearing loss, we have loud noises. Okay, this is the most rampant and I mean, this one is so very sincere and common in our day-to-day life. So loud music or loud noise, okay? Noise from earbuds. Oh, I didn't bring it, but I do have it. Noise from earbud, headphones, or whatever you're using to listen to music. I also have this one tied around my neck. This is earphones, and this is headphones, whatever be the case, whatever you're using, is the earbud or whatever be the case. So loud noises, there we go. Let's move forward, guys. Loud noises from earbud, headphones, or whatever you're using to listen to music or sounds or whatever be the case. This is the thing. If you are playing music or whatever thing you're using and someone can hear the sound from outside, what I'm trying to say is this: if I had my earphones or whatever thing I'm using to listen to music and it's in my ear, and if my neighbor or someone closer to me can hear the sound, actually then it's too loud. That is how it tell you, oh, your music is too loud or your volume is too loud or whatever be the case. So that is how we get to detect what is normal hearing and or what is considered loud or what is considered normal. Okay, so loud noises from earbuds, headphones, or whatever you use to listen to sounds or music. This is the thing: if you are playing music or whatever sound and someone outside of you can actually hear the volume, that is considered too loud. Also concert too, with your favorite singers with a loud music, or maybe you work in a noisy environment, or gunshot can be a major cause of hearing loss. If you work in a noisy environment where they do cars manufacturing or what they do with these machines that produce a lot of noise, please make use of the equipment that they give you to put on. It can be helmet, it can be whatever thing. Please make use of them. There is a reason why they give it to you, because too loud noise can affect your hearing and cause you hearing loss at a very young, tender age. Please, let's bear this in mind. And also, we're talking about music from your cars. Oh, okay. I am a big victim of it because I like music a lot. Music keeps me going, guys. I can't tell or explain how much I love music. So music, I love music. When it comes to music, I love music. But it becomes annoying when the noise is way too much, especially in the cars. Please. I know I'm a victim of this because I play music like too loud, but I'm working on it. Trust me. We are late, so I'm working on it. When I was making this video, I was like, oh no, but I gotta do something about it. So I'm working on it, so you should work on it. So please, your music, like I said, if the volume of your music in your car is so loud that someone outside of your car can hear it, then the volume is automatically too loud for you. And of course, it can damage your hearing canal, and it can make you lose your hearing or make you be a deaf. We don't want you to be a deaf, so please reduce the volume. Your neighbors or someone closer to you should not hear your music, because if they are able to hear it, they will consider it to be too high for your hearing and can cause you your hearing loss. Okay, so the third point that we have as causes of hearing loss is sudden pressure changes caused by either a head injury or flying on even scuba diving. Scuba diving, right? Yeah, we all know scuba diving. Okay, so sudden pressure changes caused by either head injury or flying or even scuba diving. Some people, when they're flying in the air through the airlines or whatever be the case, it affects their hearing, so that can be a cause of deafness. So sudden pressure changes, like the pressure changes, and the pressure changes can be caused by either a head injury, or when you have an accident or with a bike, with a car, and you have to do like face to face, it affects your head. So sudden pressure changes caused by either a head injury or flying on the air or even scuba diving. People who dive, scuba diving, that is where, or even scuba diving, that is where somebody hits you or hard on your head or closer to your ears, or maybe an injury, and the pressure difference cause them to lose their hearing. Sometimes these people doing scuba diving, or people flying on the air, or people having injury on the face, or someone hits you hard on your face or towards your ear, please, you really need to go check out, especially when it has to do with injury, accident, face-to-face contacts, or what have you. Please go check. Like I said, your brain or your head is connected to your ears. We all know where it's located at. So please go check that out, okay? So you don't get lost, or your hearing don't get lost, or you don't become a deaf. So you want to go check that out. So we have the fourth cause of hearing loss is frequent ear infections. Guys, this is the most common and the most serious. Frequent ear infection can cause hearing loss over time. Some people have chronic fluid behind their ear drum because of allergies. This can cause hearing loss or deafness. You don't want to be deaf, so let's work on that. So frequent ear infections, please check your ears. Some people have ear fluids behind their ears, chronic ear fluids or chronic fluids coming out of their ear. It can be an infection or allergies or what have you, so please check that. So frequent ear infection can cause hearing loss over time. Some people have chronic fluids behind their eardrum because of allergies. This fluid can be because of allergies or what have you. So please, this can cause you your hearing to lose. Also, meningitis at one point, muscles or chickenpox, measles or chickenpox. This can affect your nerves and also affect hearing in some people. So please check out for that. If you have a measles, chickenpox, fluid coming out of your ear, please, you have to check that, because infection can be a major cause of hearing loss, thereby making you to become a deaf, somebody who cannot hear. Okay, so the fifth point that we have as causes of hearing loss is hearing loss at birth, caused by genes. It can be premature birth, it can be low weight. So when we talk about hearing loss at birth, we are talking about what happened that you were giving birth, because some people actually were giving birth and they cannot hear right from birth. So you can also lose your hearing from birth. So hearing loss at birth caused by, it can be through genetics, or it can be through premature birth, or it can be through low birth weight. It can be through problems with the way the ears were formed. That's why I keep saying that as when you give birth, it's a miracle. This is a miracle because so many things can go wrong in the course of you being formulated in right from the womb. Some cells, some hormones might not act right. Instead of acting this way, they might act that way. So whenever a child is born, like in the hospital, I always tell myself a miracle just occurred. It is a miracle because so many things can go wrong. This is science. We prove and unprove and reprove and whatever be the case. So as a child or whatever be the case, don't always say to yourself that you're useless. You are not useless. From the genesis of reproduction, we have about 450 million cells or sperms that have been released in one ejaculation. 450 million cells being released in one ejaculation, and so many died on the way before they reached the egg for fertilization to occur. And even those that, try and reach the egg for fertilization to occur, many of them died around the egg. Many of them are unable to penetrate the egg in order for fertilization to take place. So you've been choosing among 450 sperms that was released in one ejaculation is a miracle. And that brings you to the point where you should say to yourself that I'm a miracle. I am important, because for somebody to choose you out of 450 billions, it means you are indeed important. So never you say to yourself that I am useless, I don't know, I'm living my life is so. No, you are not useless, you are not frustrated, you are as important as what it is from Genesis. You choosing out of 450 billion sperms is a miracle. So please, never say you are useless, never say you are less important. Of course, you are very, very important, very, very, and you have been chosen by God for a reason. So please, okay. So, hearing loss at birth. What I'm trying to say is that why being pregnant as a woman and up to the point of giving birth is a miracle, because so many things can go wrong. You've seen, or we have all seen people who come out without no legs, without no arm, without no eyes, without no mouth, without no nose. I mean, some of them comes and they are having a mental issue due to birth, from the problem of from the point of where they were conceived. So you coming out as a human being, as a person from your mother's womb with all the functions and abilities that so many people deny. I recently visited the one hospital in Dallas, and I saw one woman, and she was crying, and I was like, oh, what's going on? Why are you crying? She said, Stephanie, I wish I can pull like others, which means she cannot pull from the anus. They have to connect a pipe that can help extract urine from her system. That is to tell you that if you can pee, poo, drink with your mouth, there are some people that cannot eat through their mouth. So please, never say you are useless. You are very, very important. So many things can happen in the course of conceivement or right up to the stage of giving birth. But it didn't happen. It's a miracle. So please, hearing loss at birth can be caused through genetics. It can be caused through premature birth. It can be caused through low birth weight. It can also be problems with the way the ear is being made, or the head. A face was developed virus infection during pregnancy. That's why it's always advisable as a pregnant woman, please go in for checkup as often as possible, okay? Because you can be infected without knowing, and that can affect the baby in the womb. That is how some people or some babies are being born, prematurely. Their head is not well formed. Their structure, they are not coming out with all the body parts that a normal human being is supposed to be coming. So it has a lot to do. It can be genetics, it can be premature birth, it can be infection from the mother, she neglects her check-ins from the hospital, being pregnant and what have you. So it can be due to that. So hearing loss can be due to birth defect right from birth. So the 6th point that we have as cause of hearing loss is medications. One of the things that I remember in my med school days is learning about certain medication, what we call ototoxic. So there is this branch of medicine in med school that we get to study that had to do with ototoxic, or whatever be the case. So please, make sure to always consult your doctor when you have any concern. All right. So medications, like I was saying, that means that they are toxic to the ears and actually causes hearing loss. So medications, like I was saying, one of the things that I remember in my med school days, learning about certain medication, what we call ototoxic. Ototoxic. That means that ototoxic is when certain medications have been toxic to the ears and actually cause hearing loss. So the 7 point that I have is aging. As we get older, for a number of different reasons, hearing loss becomes more prevalent, and aging is a big part of that. So this one is beyond our control. Normally, as you get old, you start having problem with hearing, and that is why most of the times as you age, your hearing also decreases. So signs and symptoms of the fact that signs of losing your hearing is that one of the signs that you notice as you grow, or one of the signs that you notice that I'm losing my hearing, these are the signs: turning the TV volume too high or too loud. That is how you get to know that you're losing something and you're losing your hearing. So one of it is when the music or the volume is too high. You cannot hear it when it's normal. You have to like increase it to 80, 70, 80, 90, 100. That is when you should be telling yourself that something is wrong with my hearing. Another sign is that if you find yourself shouting, sometimes some people, they feel like if they don't shout, nobody will hear them because they themselves cannot hear themselves. So that is when you know something is wrong with your hearing and needs to be checked out. Also, asking people, can you say that again? Can you repeat yourself? Can you say that again? I didn't get you. Can you repeat yourself? When you start acting like that, then something is wrong with your hearing. Go check out for that. Asking people, can you say that again? Any of these, go get your ears checked out. Go to an audiologist and get a hearing test done. Go to an audiologist and get a hearing test done. Also, 8 point of signs that you're losing your hearing is that getting an object stuck in the ear. So this is the cause, not the sign. So continuation of the causes of hearing loss is that getting an object stuck in the ear. If there's an object in your ear and you don't get to the doctor for them to remove it, definitely be aware that you might lose your hearing. Okay, you might be deaf at one point. So getting an object stuck in your ear can cause you deaf in the future, or cause you to lose your hearing. So the 9 point that I have is medication side effect. So medication side effect can cause you to lose your hearing. So medication, one of their side effects is that maybe in a given period of time, 8 hours, for the past 10 hours, 8 hours, you cannot hear well. And most of the times the doctor will tell you that this medication you're taking, please be mindful of it and know that one of the consequences is that you're going to lose your hearing for 5 minutes, 10 minutes, 2 hours, 3 hours, and what have you. So bear that in mind. Hearing loss can be a cause of medication side effect. The 10 point that I have as cause of hearing loss is medical conditions such as diabetes, childhood infection such as syphilis-induced sexual transmitted disease, meningitis, osteoporosis, shingles, mumps when your jaw becomes enlarged, and much more. So please, medical condition can also be a contributing factor of your hearing loss. Okay, so medical conditions such as diabetes, childhood infections, sexually transmitted disease such as syphilis-induced, meningitis, osteoporosis, shingles, mumps, you name the rest, can be a cause of your hearing loss. So we're going to talk about treatment, remedy. Now we move forward, okay guys? I want this video to be as short as possible. I don't want to take much of your time. Okay, so treatment. If your hearing loss is due to loud noise, please reduce the volume. The second treatment is that consider taking vitamin A, C, and vitamin E alongside magnesium. So treatment for hearing loss. If your hearing loss is due to loud noise or volume or music volume, please reduce the volume. Second treatment is that consider taking vitamin A, vitamin C, and vitamin E alongside with magnesium. The third remedy is that if it is as a result of growing older, then folic acid might help. Fourth remedy is that through surgery or hearing devices such as hearing aids. So you can get those treatment or remedies from. Also, this is a nota bene for you to note. There are 5 types of hearing loss. Depending on the seriousness or integrity of the hearing loss, or intensity, of the hearing loss, there are 5 types of hearing loss. We have conductive, we have sensorineural, we have central, we have mixed hearing, and we have functional hearing loss. So the very first one is conductive hearing loss. This happens when sound cannot get through the outer and middle ear. It is usually hard to hear soft music. Treatment, medication, surgery can often fix this type of hearing loss. So the first type of hearing loss is conductive hearing loss. Conductive hearing loss. This happens when sound cannot get through the outer and middle ear canal. It is usually hard to hear soft music, and the treatment for this kind of hearing loss is medications or surgery. Can often fix this type of hearing loss. And the second type of hearing loss that we have is sensorineural hearing loss. Sensorineural hearing loss is this is caused by damage to the inner ear or inner drum or the nerves from ear to the brain. So sensorineural hearing loss is when it is caused by damage to the inner ear or the nerve from the ear to the brain. And this is a permanent hearing loss. This is permanent. In adults, it's caused by aging and prolonged exposure to loud music. In children and infants, causes include congenital abnormalities or infection, like I said, from childbirth. Congenital abnormalities or infection. So sensorineural hearing loss is a permanent hearing loss for adults, and is caused by a prolonged exposure to music. So treatment that can help sensorineural hearing loss is that treatment that can help, but this condition can't be cured. It cannot be cured, but treatment can help, like hearing aid, what have you. Okay, so the third types of hearing loss is central hearing loss. This is caused by a problem with the auditory nerve or sound center. Sound waves may travel through the ear, but this nerve pathway is unable to send electrochemical impulses to the brain. As a result, the hearing central do not receive the signal correctly. So the third point, like I was saying, is central hearing loss. What is central hearing loss, and what causes central hearing loss? This is caused by a problem with the auditory nerve or sound center. Sound waves may travel through the ear canal, but this nerve pathway is unable to send electrochemical impulses to the brain. As a result, the hearing center do not receive the signal correctly. It's like you get something, but it translates differently to your brain. That's what we're talking about. Okay, so treatment. If the auditory system is not destroyed, then it can be ameliorated medically or surgically. It can be treated medically or surgically if the auditory system is not being damaged. But if it is damaged, and that's it, it's damaged, is damaged. So the 4 types of hearing loss is mixed hearing loss. So what is mixed hearing loss? Mixed hearing loss occurs when there is both conductive damage in the outer or middle ear and sensorineural damage in the inner ear or auditory nerve. Treatment can be treated medically with hearing aids. I don't have one here. Yeah, it can be treated with hearing aids. So the 5th point that we have is functional hearing loss. Functional hearing loss or cytogenetic functional hearing loss is described as any hearing loss that cannot be explained by an organic cause. Hence, it is considered or classified as part of a conversation disorder in the field of psychiatry. So functional hearing loss is when it's described as any hearing loss that cannot be explained by an organic cause. Hence, it is considered or classified as part of a conversation disorder in the field of psychiatry, which means you cannot have a conversation with this person. This person does not hear you at all, like at all. Okay, so functional hearing loss is also known as psychogenic. Functional hearing loss is also known as psychogenic, and it is described as any hearing loss that cannot be explained by organic cause. We don't know the cause of it. Hence, it is considered or classified as part of a conversation disorder in the field of psychiatry. In the field of psychiatry, it is considered as a conversation disorder because you cannot have a real conversation with this person. So that's what we're talking about. So a treatment for hearing loss is if your auditory system is not damaged, it can be corrected or medically or through surgery. And also another treatment or way to remedy this thing is by using hearing aids. So please, we don't want to get to the point of using hearing aids. So please, let's say no to loud music, and let's say no with putting up stuff in our ear, or let's treat infections of the ear if we have some. That's what I have for you guys today. Thank you for watching.